My name is Susana Arango. I am originally from Colombia and I have been working with the Visual Heart Laboratories and the Department of Anesthesiology to develop an educational platform to teach cardiovascular anatomy, physiology, and echocardiography. Dr. Matt Kynes is a pediatric anesthesiologist here, and he gave grand rounds at the University of Minnesota a few months ago, and I was so interested in how they are advancing education in Africa and Kenya specifically, and talked about how we could implement all these tools and these technologies in training everyone here, and that's how I got to know the institution. We have been using 3D models of a real human heart and virtual reality and augmented reality applications to help trainees understand the complex three-dimensional anatomy and how it relates to echocardiography and ultrasound, which is a procedure that we do in the emergency department, in the critical care setting, and especially now in the perioperative space. We know that ultrasound is a valuable tool. However, training is very complex because we are used to looking at the heart in a two-dimensional fashion through books and videos, but we know that cardiac anatomy is extremely complex. So giving the trainees and learners the opportunity to visualize it is hopefully gonna help them enhance that learning and make the learning curve way faster. Right now, we have started doing workshops within different departments, the residents of anesthesiology, family resident medicines, emergency and critical care clinical officers, and all the KRNA students at the institution.
Ultrasound has become one of the most important tools in every department, and anesthesia being one of those departments, and we've been using for different purposes. And now with the TTE trainings, we've been using ultrasound for pre-op, intra-op, and post-op scanning of patients. And with this training, we've been getting a lot of new materials, and the 3D models have really helped us to understand what we are actually scanning and what we're actually looking for whenever we're scanning a patient. And that made it very easy to use the ultrasound and to actually look for any pathologies or any problems with the patient's heart.
The program was very helpful. Like before, I never had a training on doing an ultrasound on the heart. But then before, I used to think that the heart is taken as one dimension, but now I've learned that it's looked at 3 dimension, and that was really helpful.
I want to give special thanks to the University of Minnesota, the Visual Heart Laboratories, the Institute of Engineering in Medicine, for the donation of the Sonosite equipment, which will make this way easier and way more effective. This will for sure change the way things are done here in terms of ultrasound capabilities. And finally, immense thanks to Dr. Greg Sand and Matt Kynes and AC Kijabe Hospital for opening the doors for us. Asanteni sana.